Hi, I'm Dr. Canseco.
I'm Dr. Eisfelder.
And this is
The Frontline
ER. So we're seeing a lot of people wearing masks out in public.
In the grocery stores, out on walks, in their cars.
And as of April 3rd, the CDC is now recommending that you wear a fabric mask or a bandana over your nose and mouth when you're out in public.
Please note, specifically, we are not talking about surgical masks. We're not talking about the medical kind. We're discussing fabrics such as bandanas, scarves, etc. that you already have in your house.
But we know that a lot of you already own medical grade masks. Social media and the news are portraying that the healthcare community is upset with the public for stealing their masks and wearing them out in public.
I'm here to clarify. What we're actually mad about are people who went out and just bought tons of boxes and hoarded all of them to the point where they didn't leave any for the rest of the healthcare workers.
In reality, the deed is done. Nobody knew that the hospitals were going to run out. What we will get more angry about is if you wear them and use them incorrectly.
Because it basically means that one, you're both being super wasteful with your mask, and two, you're not actually protecting anyone, not yourselves and not others. So I guess it's time to
talk about masks.
Today we're going to discuss
how COVID spreads,
types of masks and their effectiveness,
how to handle and wear these masks,
rapid Q&A,
and what else you can be doing to protect yourself.
Please note that we're going to be using many studies in order to give you this information in the video.
Below in the description, as well as at the end of this video, will be linked all of the references.
We also highly encourage you to either read some of the studies yourself or do any additional reading.
So let's talk about how viruses spread.
When we say the word droplet, we're referring to very small particles that you can barely even see being exhaled through your mouth, or when you're coughing or sneezing, those small particles will actually either be coughed onto somebody, or they will land on nearby surfaces where they're just going to sit until somebody touches them and then touches their face.
And those surfaces are called fomites. So you breathe in these particles and they go into your lungs through your nose or through any of your mucosa, which are the soft, porous parts of your skin.
And the reason this is important is because somebody actually took the time to study the velocity of a sneeze and how far it travels. And apparently, it typically travels only about a meter, or for us Americans, that's approximately 3 feet.
So if you're practicing safe social distancing and you're staying within 6 feet of anybody around you, you're protected.
Even without a mask.
So when we're talking about airborne particles, we're talking about particles that are much, much smaller. And we brought some demonstrations.
Let's talk about droplet.
So a droplet is about this size. So it's about 5 to 10 micrometers in size.
You would have to blow up a droplet by 1,000,000 times to get about this size.
This is an airborne particle.
Blown up by 1,000,000 times.
It is less than 5 microns.
Obviously, something that is this much bigger and this much heavier is only going to travel a short distance.
This, on the other hand, is really light. So it's going to travel and stay in the air for a lot longer. And that's what makes airborne diseases so much more of a risk. Typically with COVID, we're talking about droplet transmission.
Most of the studies coming out preliminarily from China are showing that when they look at over 75,000 people, everything that got transmitted and spread was through droplet.
Now, there's still American follow-up studies being done to see if there is an airborne component to the disease.
Most of them are looking at high-risk procedures within the healthcare setting, just because when you're thinking about somebody putting a tube down a throat to help them breathe, everything in the lungs can come out into the room, into the faces of the people who are doing those procedures.
And we really need to make sure that those high-risk procedures aren't making us more susceptible to getting the disease. Thus far, we don't have any proof that it's airborne. It's in fact acting like a typical virus and spreading through respiratory droplets. So this is important because if we know how it spreads, then we know what kind of protection we need. And we know what kind of masks to wear.
So please keep in mind that the CDC guidelines, again, are for fabric that you have at home over your face, not necessarily for those medical masks.
And now we don't make any judgment on anybody who has these masks already in your home, as you may have them in your home for many other reasons.
So for those of you who are actually wearing those masks or the fabric at home, we are going to talk about the different kinds and how effective they are.
And we're going to talk about 3 different types of protection. Number 1, the respirators. Number 2, the surgical masks. And number 3, the fabric or cloth masks.
So to start with, we are going to talk about respirators. One of the types that we're going to talk about is something called a P100.
It's called a P100 because it filters out 100% of particulate matter during inhalation. As you can see, it has a silicone base that makes it really comfortable to wear, and it has these pink cartridges, which can last for an extended period of time of up to 40 hours of wear and keep you protected. It's typically used by cancer patients to protect them from bacteria and viruses in the air, but it's also used by construction workers for when they're working with asbestos or when they're building. The next type of respirator is an N95.
This is going to be one of the most common ones that you're going to see our healthcare workers using. Similarly to the P100, it is going to have a tight fit around the face and filter 95% of the particles that we are inhaling. Now, importantly, there are multiple sizes of this mask. This is going to be actually governed by the National Institute for Occupational Safety and Health.
What that means is that every healthcare professional is specifically fitted for these masks so that we know that they're protecting us appropriately.
So when healthcare workers are wearing these, it's most important when we're around infected patients, because if we're within a 3-foot radius of someone who is actively sick and coughing on us, it's going to protect us with that extremely tight fit that we know has been approved by a governing body.
The second type of protection is a surgical mask.
These are loose fitting masks whose main purpose is to create a physical barrier between whoever is wearing them, the nose and the mouth, and the environment around them.
Surgical masks may also reduce the exposure of your respiratory secretions and your saliva when you cough or sneeze or when you exhale.
So let's talk about the effectiveness of protection, as in each mask that you wear, how much does it actually protect you from being infected by this virus? So if fitted properly, an N95 is up to 95% effective.
Now the surgical mask, on the other hand, is 33 to 50% effective.
Once we put these on, you can see that the fabric is much flimsier, it has a different filtering capacity, and there's gaps along the edges.
Now, the third type of protection are the bandanas that the CDC is asking everyone to wear.
These have only been shown to be between 3 and 11% effective in filtering things out when you are breathing in.
Now, the reason that the CDC is asking us to wear these while we're in public is actually to protect others from our particulate matter.
A few studies are coming out of China and Iceland showing that 25 to 50% of people being infected in the community are actually because of silent infections. That means that people are unknowingly spreading this virus without having any symptoms.
So wearing the mask helps you protect others from your potential viral infection.
But it's going to take everyone really actually participating in this to even hypothetically help. I urge all of you to be very cautious as a blanket statement with a lot of the social media and infographics that are out there regarding the actual efficacy of surgical masks, because some of those sites are actually stating that they're 97% effective, and we know in comparison to N95s, they've got a lot of gaps, they have flimsier fabrics, they are just not going to be as effective.
An N95 mask is, by definition, 95% effective at filtering particulate matter that is airborne. If you remember our rock from earlier, so less than 5 microns in size. And as you can see, it's tightly fitted, so the particle doesn't get in.
So logically, if something has gaps in it, those small particles are going to go in much easier with no difficulty. So please be cautious on those statements. So it is important to know how to wear these masks. But first, let's go over how you shouldn't wear them.
Yeah, you have to put your mask on before masking others. So let's talk about the right way to wear all of these masks.
Hold on, let's remember, before we put on any masks, you always have to think that your hands are infected. So 100% of the time, you need to be washing your hands.
20 seconds, people, come on, at least.
So, knowing that fact, let's start with our N95s, which do have a few caveats. The first of which is that currently there are no CDC guidelines actually stating that you should be using and wearing these in public.
Number 2, if you got a mountain beard, then N95 is not for you. There's no protection conferred with people with beards.
And the third of which is going to be that we can't guarantee an actual 95% protection because there's no way to test that the seal is working for you properly at home.
So let's show you how to properly wear an N95. Take your mask and hold it in your hand. Place it over your nose and mouth. Take the bottom strap and put it over your head on the nape of your neck. Take your top strap and put it at the crown of your head. Once your mask is secure, touch the metal portion around the bridge of your nose and press down into your nose, making sure that there is a tight seal. Make sure you press down on the top of your nose, on the bridge of your nose, to make sure there's no bubble.
And if you do an exhalation like this, and you're wearing glasses, you really shouldn't see much fogging.
Next, we're going to show you how to put on a surgical mask. One side of your surgical mask has a wire and the other side does not. You're going to take the wired side and put that over your nose. You're going to then loop the loops over your ears. You're going to mold that wire around your nose and the bridge of your nose so that you create the tightest seal possible. Make sure the bottom of your mask is covering your chin.
All right, so right now we are going to demonstrate how to properly handle your mask. And for this example, I am just going to be a normal person in the community. I'm actually infected with COVID, but I'm not showing any symptoms yet. I'm not coughing, I don't have a sore throat, I don't have fevers. I have no idea that I'm sick. And for the purposes of this demonstration, know that we're going to be wearing gloves. It's just because we're going to be using red paint representing the germs of potential spread, and we don't want to get our fingers messy and stained red. For this example, I am going to be going to the grocery store. I have clean hands right now, and I'm in the store and I have a little bit of a scratch in my nose. Sometimes I have seasonal allergies. I'm not wearing a mask because I'm not quite sure if that will help or not right now. So I'm feeling the itchy, oh God. All right, so I have now sneezed into my hand. I have this over my hand, but I'm not really thinking about it because I'm not sick, it's okay. I see this box of maybe some cookies that I want, and I'm looking at them. And you know what, I'm trying to eat healthier, so I'm actually gonna put this back on the shelf. And at this point, I'm gonna walk away, but someone else in the grocery store is gonna come along.
I've been practicing great hand hygiene. I'm wearing a mask out in public. I'm ready for this. I see a box of goods too, and I pick it up. I'm looking at it. You know, I think I'm wanting to take this home, so I put it in my cart. Oh, but you know, my mask, that's really bothersome. Like, I hate wearing these things. They make me feel so claustrophobic. I'm just gonna take it off for a second. As you can see, I'm now contaminated.
But she was doing so well. She had this sense of security. And in this circumstance, she's gonna put her mask back up and go home because she thinks that she has remained germ-free and not contaminated because the mask went back into place.
As you can see, there's contamination on my mask and on my face.
The biggest thing we want you to take away from this video is that it's very easy to have this idea that you're not spreading germs around the community. And the biggest thing you can do before handling, touching, taking on and off a mask is to wash your hands.
Ideally, if you're leaving the house and you're putting a mask on, we don't want you touching the mask or your face at all until you've come home and washed your hands.
Because every single time you get those germs on your face from adjusting your mask or feeling claustrophobic, you can see the red on her face, it is very close to those mucosal surfaces that are going to allow her to get infected.
All right, now that we've shown you how to properly put on your N95, we have to show you how to safely take it off.
And knowing what you know about how everything is infected now, we're gonna show you an at-home method you can use to safely store your mask without having to constantly touch the outside of it when you're taking it off and putting it back on.
Number one, we want you to remember is not to touch any of the blue portion of this mask. We want you to consider that completely infected.
And anytime before or after touching this, you are going to, yet again, wash your hands.
You're gonna take a Tupperware container, and that's what's gonna be your DIY way to take these masks off.
So you are going to put your face in the Tupperware container. Then you are going to actually remove the strap onto the outside of the container. One at a time. 1, 2. Take it away, and now you have a safe method at home where you are not touching the outside of this mask, and you can put a lid on it with a hole so that it has some room to breathe until the next time you need to use it again. Now, unfortunately, that Tupperware container method does not work as well for the normal surgical mask.
So we're going to show you how to take off the surgical mask without touching this portion at all. Again, hand hygiene before you touch anywhere near your face.
After that's done, you are going to take both your fingers and not touch the outside, but go towards the actual loops around your ears and pull these off. Without touching anything, you can then go to a plastic bag, paper bag, whatever you want, and put your individual mask inside of it, ready to be used for the next time.
Seal it up, and you're ready to go. Now it's time for our
Rapid Q&A on masks.
Dr. Eisfelder, what are the benefits of wearing a fabric mask?
As you know, we just covered this. It is going to protect others when you are coughing, sneezing, etc. But importantly also, it can protect other people even when you don't have symptoms, but potentially could be infected. Secondly, it does give you a tiny bit of protection, and you know what? Most of us will take whatever we can get during this time period. And finally, I think it makes a lot of people feel better.
Reduces a lot of anxiety.
Dr. Canseco, what are the potential risks of wearing masks?
They can definitely give you a false sense of security. They're only going to give you any protection. They're really only going to protect anybody else if you handle them appropriately, just like we've explained earlier. Remember, washing your hands and hand hygiene is of the utmost importance. When should you wear a mask?
So the most important place to actually wear these masks in public is going to be into crowded places. So the grocery store, the pharmacy, anywhere where you're going where there's going to be multiple people around you, trying to keep that 6-foot distance, of course, but that is going to be the highest risk areas. Next question, when is wearing a mask not helpful?
So it's definitely not going to be helpful when you're alone, sitting in your house, or if you're alone driving your car. It's also not really going to be that helpful if you're going out to check the mail in your footy pajamas at 11 p.m. when no one's outside. Just saying. Next question, are there certain people who shouldn't wear masks or fabric covering their face?
Great question. So yes, little children, those who aren't able to actually speak to us and let us know that they're feeling short of breath and dear God, take this fabric off my face, those would be the ones. So typically less than 2 years old. Also, anyone who is older and may have dementia or Alzheimer's. Anyone who can't speak to you to verbalize that they can't breathe appropriately and you need to take it off. Or people who cannot take the mask or fabric off themselves. It could be dangerous.
So what should those people do?
They just don't wear them. You follow all the other ways to protect yourselves with social distancing and washing your hands.
And staying home.
Okay, so should people be washing their cloth fabrics after they use it?
Absolutely. After every single use of those cloth fabric masks that the CDC is recommending, we want you to take them off and place them in the washing machine immediately. Should I wash my N95s or my surgical masks?
This is a highly debated topic, but when you're saying the word wash, don't put them in the washing machine. That will totally degrade them. What we're talking about when reusing these masks is, can you sanitize them? Can you wash them with soap and water? And honestly, the jury is out on the best way to actually reuse these. So we don't recommend making them wet or putting soap on them or hydrogen peroxide because we don't have proof or data right now that they remain intact. So the best thing you can do is to take them off as carefully as you can, with Tupperware or bags or whatever you can and staying nice and clean yourself. But the second that they get soiled or someone is coughing straight into your face or they're wet in the rain, consider them basically unusable and you should throw them out. Knowing what you know now on how the virus spreads, the types of masks and fabrics, how effective they are, you've noticed that we've mentioned multiple times that there are other things that you can be doing to help protect yourself.
We want to emphasize right now that wearing a mask is not the only thing that you can do to protect yourself and to protect others.
It is not a magic blanket of protection the second you step out of your home.
The most helpful things that you can do to protect yourself are, number one, respecting the social isolation.
If you are far enough away, in reality, most of those droplets shouldn't even hit you. And if you're wearing a mask, you know, it can give you that little added benefit of protection, but really the distance is the most important part.
Number two, wash your hands frequently and well.
We think that this is so important and we harp on it so much that we are going to give you a final demonstration on how to properly wash your hands. So we're going to show you examples of washing your hands using a red paint as the simulation of water and soap. So to start with, we're going to give you a bad example. What most Americans may have previously done. Just putting the soap in, hurrying up, doing whatever they have to in the bathroom, just quickly doing it within a few seconds and done. You can see that on both sides of the hands, there are a massive amount of areas that have not been properly cleaned and therefore could have germs infecting them when they touch you or other people or surfaces. Now we're going to show you the example of what good hand washing looks like. So using the soap and water, you are going to start with the palms of your hands and spread it all around. From there, you are going to go to the backs of your hands, making sure to cover both sides. Then you are going to do the spaces in between your fingers, switching off both hands and making sure to get in between, and then putting your palms together and doing the web spaces again. Lots of people forget about your thumbs, so you are going to focus specifically on your thumb areas. Next, people tend to forget about their fingernails and fingertips, so you can do this by two ways. One is by spreading the soap in the palm of your hand on both sides, and the other way is by putting your hands together and moving from side to side. And last but not least, you have to get your complete wrists. The entirety of washing your hands should last 20 seconds, or approximately humming through 2 happy birthdays. If you look at the difference, the entire hands back and front have now been appropriately cleaned.
Some other things that you can be doing to protect yourselves and to protect others are just simple things that you would do if you were sick any other time.
So you're gonna avoid anyone who's sick, or if you're sick.
Avoid touching your eyes or your nose or your mouth or your face in general.
If there is absolutely no way that you can avoid going out when you yourself are sick, you should at all times have your face covered so that if you're coughing, it's caught within the fabric.
Or cough or sneeze into your elbow. Make sure that you're cleaning and disinfecting areas that you touch frequently in your house with either some household cleansing spray or a wipe.
And finally, there are a lot of people who are essential workers. A lot of us still have to go to our jobs. So if that happens, after you're done with work, change into clean clothes. This will help things from being spread to your car. As soon as you get home, you should be showering.
That's what we're doing, at least.
Is there good science on it or data right now? Not really.
Nah, not really. But it's the best we can do.
And we're all trying the best we can to protect everyone that we love and care about in our homes. And finally, here are the 5 things that we want you to take away from this video.
Number 1, COVID is likely droplet. So make sure that you're covering your face when you're going outside and staying 6 feet away from others.
2, a mask will protect others when you're exhaling, sneezing, or coughing. So make sure to wear that fabric or mask over your face, but we have to all do this as a community for it to truly work.
Number 3, if you are going to use a mask or a respirator, make sure that you know how to put it on appropriately and take it off without contaminating yourself.
4, if you are using a face covering of any kind, make sure that you are hand sanitizing or hand washing before and after you touch anything, 100% of the time.
And number 5, and this is a final plea from us, please consider donating your extra masks or equipment.
Some of you may work in dental offices or construction or salons that have extra boxes of these, so please Google how to donate that extra protective equipment to nearby hospitals if they're willing to take it.
This has been
The Frontline ER.
Like and subscribe down below and comment.
Post any questions you may have.
See you next time.
Bye.
Bye.
This is The Frontline ER. Like and subscribe to get more information on how... I don't know what I'm saying. We didn't make a sentence.
God damn it.